Okay, so hypertension, very common problem in the United States. You probably know somebody who has it. There's two types, primary hypertension and secondary hypertension. When we're looking at hypertension, primary means that it's also called essential hypertension and it's idiopathic. We don't know what's causing it, they just have it, all right? They have an elevated blood pressure without evidence of anything else going on, all right? So they haven't had a heart attack, they don't have renal disease, all right? They just have high blood pressure, all right? This happens in 90 to 95% of all of our cases. There's certain risk factors that increase this. Overproduction of sodium-retaining hormones, right? Vasoconstrictors, increased sodium intake, overweight, diabetes mellitus, that's what DM is abbreviated as, excessive alcohol consumption, race, age, and smoking. Secondary hypertension means that it's related to some other disease or process that's going on. So the blood pressure is elevated secondary to something else, and we can identify that. All right. Common things are renal disease, endocrine disorders, brain tumors, sleep apnea, use of stimulants like cocaine, contraceptive pills, birth control is a common one, cirrhosis, and even pregnancy-induced hypertension. Right. To diagnose essential hypertension, we're going to focus on this one because it's a way most common, 90 to 95%, right? You have to use a blood pressure cuff, which is also called a sphygmomanometer, that's the real name for it, and a stethoscope. Somebody has to have 2 high blood pressure readings at 2 separate visits. All right, so in other words, they come in one day, their blood pressure is high, you wait 10 minutes to check in again, it's still high. We can't do that, all right? If their blood pressure is high, then they should come back, and the next time we check it, if it's still high, then they can be diagnosed. Hypertension is whenever anything's above 140/90. Now, if you look at the table, we'll see the pre-hypertension stage and stage 1 and stage 2. Right? This is to give you an idea of where they might fall. And when we know whether they're stage 1 or stage 2, we'll talk about treatment guidelines. Blood pressure should be taken when the patient is relaxed. We should advise them, especially if they're coming back in for a blood pressure check, to not have taken any stimulating things like caffeine or smoked in at least the last 30 minutes, because that can give us a falsely high blood pressure. So some things that influence somebody's risk for getting essential hypertension. Heredity. All right, we see that there are instances where people have heredity run in their family of hypertension. Right, water and sodium retention. Anything that causes a patient to excessively retain sodium or water is going to increase their preload, which can give them hypertension. Right. Altered renin-angiotensin mechanism. So something that is going to affect the ability of the body to convert angiotensin to angiotensin 1 can impact their hypertension. All right, stress is going to influence the sympathetic nervous system. All right, it's going to stimulate it. All right, it's going to increase blood pressure when people feel angry, fearful, and in pain. All right, this is going to increase their blood pressure. All right, if someone has chronic problems with managing their emotions, managing stress, they're going to have hypertension. All right, insulin resistance and hyperinsulinemia. All right, this is why diabetics fall into a high-risk category for hypertension. High insulin concentrations in the bloodstream, all right, can cause hypertension. And then if we have problems with our endothelial cells, all right, so our cells that line our vessels, they cause prolonged vasoconstriction that's going to lead to hypertension. All right. So people don't usually feel hypertension. So you have to kind of ask the question, well, why do we care so much? All right, if it's not causing them to overtly be sick, like what's the big deal? And the big deal is that because hypertension essentially is the base for almost all of our other cardiac problems, as well as neurological things like stroke. All right, so it's related to vascular weakness. If your vessels are always put against this constantly high pressure, then they're going to get weak over time, all right, and it's going to damage them. It can also cause scarring. It increases the risk for blood clots, as well as plaque formation in the blood vessels. Our tissues and our organs are going to get damaged, all right? They can get blockages and narrow, so then our tissues don't get enough blood flow to them. And it overall increases the workload of the heart and can lead to left-sided heart failure. target organ disease, and it's also sometimes called compelling factors, all right, when we're talking about treating hypertension, is whenever the hypertension has caused damage to our organs, all right. The heart disease, it can be cardiovascular disease, all right, atherosclerosis, cardioarterial disease, left ventricular hypertrophy. It can cause damage to the heart and lead to heart failure. Okay. The brain can be impacted from hypertension by having cerebral atherosclerosis or plaque formations in the brain blood vessels. It can lead to stroke. Peripheral vascular disease, it can cause aneurysms, and those aneurysms can dissect or rupture and cause damage to blood vessels. All right, the kidneys can be damaged and cause end-stage renal disease or decreased blood flow to them. That's ischemia. The retinas of the eyes, because these are our smallest blood vessels in the body, all right, they're more prone to damage than anywhere else. So it can cause damage to these vessels, which can lead to blindness and blurred vision. Okay. The last video in this segment talks about treatment options for essential hypertension. So you can pick up there with video 4.